my name is Stephanie Camero Maldonado, and I will be presenting our work on beliefs towards COVID-19 booster acceptance among immunized adults in Puerto Rico, assessment of the Puerto Rico Community Engagement Alliance against COVID-19 disparities. The COVID-19 pandemic is still a public health problem, as it has been ongoing for 2 years. The World Health Organization has already stated on March 18 of this year that the pandemic is far from over. COVID-19 vaccination has been essential throughout the pandemic to safeguard the population's health. And although the vaccine showed to be effective in protecting against severe disease and mortality, boosters are needed as immunity wanes over time. In Puerto Rico, vaccination against COVID-19 has been successful, and its high rate has been praised and recognized worldwide, with 86% of the eligible population being vaccinated. However, we are still lagging on booster vaccination, as 58% have gotten the booster vaccine. Because of this, we need to understand predictors of booster vaccination to enhance COVID-19 booster uptake in Puerto Rico. The health behavior model has been widely used to understand health behaviors, including vaccination. We wanted to evaluate the beliefs towards the booster among immunized adults in Puerto Rico, and if these were associated with booster acceptance and refusal. The study was a cross-sectional and secondary analysis of a survey conducted as part of the PR-CEAL initiative. For this, PR-CEAL conducted an online survey that was carried on from December 2021 through January 2022. The survey was distributed through institutional newsletters, academic groups, and social networks, as well as in person at selected supermarkets. Participants were those 18 years or older who resided in Puerto Rico. For statistical analysis, we calculated frequencies and mean. To evaluate the bivariative association between booster acceptance status and each barrier and benefit, we used chi-square test. Overall, we had a sample size of 529 individuals with the mean age being 38 years. 73% were female, and 53% had some college education or were college graduates. This graph shows the booster vaccine acceptance status in our sample, where 91% were booster acceptance and 9% were classified as booster refusal. This table shows the association between the booster barriers and benefits and booster acceptance status. Overall, we observed that about 40% of the sample still had concerns over the booster safety, efficacy, and side effects. We found that a greater proportion of individuals with booster acceptance agreed to both booster benefit items. For example, 80% of those with acceptance agreed that the booster was a good idea because it makes them feel less worried about catching COVID, whereas this was only 12% for those who refused the booster. We also found that a greater proportion of individuals with booster refusal were more likely to agree with the booster barrier items than those with booster acceptance. For example, 82% of those with refusal reported being concerned about the safety of the booster, whereas this was 38% for those with booster acceptance. In conclusion, COVID-19 booster acceptance was high. Vaccination barriers remain high in the total sample, and it was even higher for those with booster refusal. Vaccination benefits were higher for those with booster acceptance. Thus, public health campaigns need to target booster barriers and benefits to reduce booster vaccination refusal. This research reported in this NIH Community Engagement Alliance against COVID-19 Disparities publication was supported by the National Institute of Health under the award number. Thank you for your attention.